Good day! My name is Jeffrey C. Consuegra. I am from Brisen 11P and I'll be going to perform complete bed bath. So firstly, I'll be going to perform hand hygiene or hand washing and also provide privacy to the client. This will prevent cross-contamination and ensure the client's dignity. So now, I'll be going to identify, explain, and assess the client's condition. This will enable me to clarify if it is the correct patient that I'll be going to render the correct care. So, good afternoon, ma'am. My name is Jeffrey C. Consuegra. I'll be your student nurse for today. May I ask your name and your birthday?
My name is Mabiji J. Ramos, November 2, 2005.
If you may, ma'am, can I have your wristband? Okay, thank you so much. And now, ma'am, I'll be going to perform complete bed bath, which is I'll be going to clean you from every parts of your body to ensure cleanliness and hygiene. And do you have any tenderness felt in any parts of your body?
No.
Okay, thank you so much. So now I'll be going to wears working gloves and offers bedpan and urinal to the client. And ask client to void if necessary. So this will prevent the spread of infections, and also asking client to void will help us to prevent any interruptions during the procedure. So ma'am, have you urinate already, or do you want to void?
No.
Okay, thank you so much. So now I'll be going to bring the necessary equipment and where's the correct PPE. So this will enhance and make a time economy and also prevent contaminations with the patient. So I'll be going to wear the PPE. So next, I'll be going to raise the bed to a convenient working height, and also I'll be going to lower the side rail where the nurses do his or her job. So I'll be going to raise the bed, assuming that I'll be going to raise the bed. So raising the bed will ensure proper positioning of the client, and lowering the side rail will enable us to prevent clients for risk for falls. So, assuming that it is elevated 30 to 45 degrees, 30 to 45 degrees. So, this will be used as a side rail for patients' safety. So now, I'll be going to assist the client to move to the side of the bed. So this will enable to the nurse ensure that the care is rendered um, appropriately without overreaching. So, okay, ma'am, can you please move to the side of the bed if you may? So next, I'll be going to place the bath blanket over the patient's body and removes the topsoil sheet and place it into the hamper. So this will enable this while while lowering or removing the topsoil um, um, blanket or sheet. Um, the bath blanket will enable us to provide or to maintain the client's dignity while removing the topsoil sheet. So now I'll be going to remove the patient's gown. So this will enables the nurses to have full access to the part where the complete bed bath will be made. So ma'am, I'll be going to remove your gown, and if the client has a intravenous site or injury or any tenderness, start into the unaffected or non-tender site. This will provide comfort to the client. So ma'am, do you have any tenderness or any pain, any parts or in
No.
So I'll be going to fill the basin with 2/3 full of warm water, approximately 43 to 46 degrees, and then I'll be going to check the temperature of the water. So this will help ensure that the client will be maintain its comfort and to prevent any further injuries. So now, I'll be going to um, I'll be going to let the patient check the temperature of the water. I ask the client if she can tolerate the temperature, so that it will enables or to prevent from any burns or scalds. So ma'am, can you please check the temperature of the water if you can tolerate it?
It's okay.
So since it is okay, so let's start washing the um, it will enable us to start performing the complete bed bath. So now I'll be going to remove the client's pillow, and also I'll be going to elevate the head of the bed 30 to 45 degrees so that it will enable us to have a um, patient's comfort. It maintains patient's comfort, and also it will enable us to perform complete bed bath thoroughly. So ma'am, can I get your pillow? Can you do so? So, assuming that it is elevated 30 to 45 degrees. So now, let's proceed in washing the face. So, I'll be going to wash the face of the client. So, firstly, I'll be going to place the towel appropriately. So, firstly, the first towel will be located at the um, underneath or beneath the head of the client. And the second towel will be placed across the chest. So, this will prevent from any contaminations and also to maintain hygiene. So now, I'll be going to wash the client's eyes using the water only, and I'll be going to use the separate um, corners of the washcloth in each eyes. So this will help prevent from contamination from the dirty to the clean corner of the washcloth. Okay, so now I'll be going to wash the eyes of the client. From the inner canthus to the outer canthus with firm stroke. And the other side with firm stroke also. So next, I'll be going to wash, rinse, and dry the face, the ears, and also the neck of the client. This will ensure that all surfaces of the client's head or face will be clean, and this is to maintain hygiene. So now I'll be going to if the patient or the client is male, ask if he would like to shave. So this will ensure grooming and also hygiene to the male patient. So now let's proceed in washing the hands of the client. So first, I'll be going to expose the forearm and place the towel or the towel lengthwise the um, beneath the arm and also to the axillary. So we'll be going to remove this now. This will ensure putting blanket or towel beneath the arm will ensure hygiene also by preventing any waters flowing, dirty waters flowing from the hand. So ma'am, can you please elevate your hands? So now I'll be going to wash, soap, rinse, and dry, and then covers the head with the bath towel, arms and axillary. This will ensure that the hand is clean thoroughly. So I'll be going to perform it from the head to the axilla or from distal to proximal. So this will ensure proper circulation of the blood in our body and specifically in our hands. So now I'll be going to perform also to the other side of the hand. So I'll be going to dry it by tapping. And I'm going to remove the blanket. So next, I'll be going to perform it into the other side of the hand. We will expose it, place the lengthwise blanket, and then wash, rinse, and dry. So next, I'll be going to also wash, soap, and rinse and dry the hands hands of the client, and also the fingernails. This will ensure that all parts of the hands and arms will be clean. So I'll be going to perform it into the forearm. Next, I'll be going to do it also to the other hand. So now I'll be going to um, I'll be going to wash the chest and also the abdomen of the client. So firstly, I'll be going to spread a towel across the patient's chest and abdomen. So this will enables us to perform a bed batting to the abdomen and also to the chest, while maintaining the dignity of the patient. And I'll be going to lower the back blanket to the umbilical area to expose the abdomen and the chest only. So now I'll be going to lift the back towel and bath the chest and abdomen with my knitted washcloth with long, firm stroke. So this is to ensure that the one-way stroke prevents contamination. Okay. So now I'll be going to wash the legs and also the feet of the client, since we're done with the chest and abdomen. So now I'll be going to expose the farthest leg or the farther leg and place a length size towel into the par leg. So this will enable us also to ensure hygiene and prevent contamination of the dirty water that is flowing from the skin. And I have this towel. I'll be exposing it from the leg, ensuring that the perineum is covered to ensure client's dignity. So now I'll be going to perform the washing, soap, rinse and dry, and it covers the leg of the patient with a firm stroke from the leg into the knee and up to the thigh of the patient, or what we call as from distal to proximal. So now I'll be going to dry it by covering. And now I'm going to move. So now I'll be going to perform it into the other side also. I'm going to expose it, ensuring that the perineum is hidden or unexposed. So putting the length size towel under the and then I'll be going to perform again the washing, the soap, the rinsing and drying, and then covering of the leg from distal to proximal aspect. So now I'll be going to wash, soap, rinse, and dry also the feet of the client. And then I'll be going to put a lotion and patient preferred. So this will enable us to complete the washing and bathing the legs of the patient and also the feet. So I'm going to proceed to the party's leg. We're going to put a length size towel and then perform washing it, soaping, rinsing and drying. So this aspect will be done from proximal to distal. ensuring that all fingernails and also the corners of fingernails are clean. And put a lotion. So I'll be going to perform it into the other side. So I'm going to expose it, place the length size towel, and perform putting lotion will prevent the foot of the patient from getting any fissures or any other foot diseases. So now I'll be going to um, I'll be going to discard all the wash clothes that have been used and also maintain privacy. So I'll be going to discard all of the wash clothes. I'm going to discard it. And I'll be going to refill the basin with a clean water, so that the previous dirty water will not be used to the further bathing of the client. So I'll be going to refill. So now I'll be going to change the pair of gloves that have been used and apply perineal care. So doing perineal care will help maintain patients' private parts clean and prevent any complications such as UTIs. So now, assuming that I am done changing the pair of gloves and applying the perineal care, I'll be going also to change the water and apply also again a clean pair of gloves. So the water from the perineal care will not be used into the washing the back of the client. So assuming that I am done doing the perineal care, done changing the water, and done applying the clean pair of gloves. So now let's proceed in washing the back of the client. So firstly, I'll be going to assist the patient to into a prone or sideline position, facing away from the nurse or from me. So, ma'am, what do you want? What do you prefer? Do you want sideline or prone?
Sideline.
Okay. So, okay, ma'am. Can you please? Are you able to sideline, ma'am? Okay, ma'am. So, when the patient are sideline, ensure that it is properly covered, so that it ensures patient's dignity all throughout the procedure. So now I'll be going to wash dry the client's back moving from the shoulder, into the um, um, buttocks and to the thighs. So this will ensure patient's hygiene and also maintains cleanliness. I'll be going to perform from the shoulder to buttocks and also to the thighs. So now, I am going to dry it. So, if the patient skin is intact, I'll be going to remove the pair of gloves that I am using. So this will note that the client is able to have a back massage or any um, interventions that the doctors wanted or ordered. So, perform a back massage before, now or after the completion of the back. And also, if client preferred to be massaged. Ma'am, do you want a back massage, ma'am? Okay, thank you so much. So now, I'll be going to help the patient back in supine position. And then I'll be going to help the patient put a new gown. I'll be going to put a new gown. And then I'll be going to check the devices that is attached to the patient. So I'll be going to, this will ensure that all devices or the heat attached to the patient is intact. Ma'am, can you please go back to your supine position? Ma'am, can you please, can I have your hands? And then, I'll be going to remove the blanket that is attached to the client's, or spread it into the client's chest. So now, I'll be going to comb the patient's hair properly. So this will ensure that the patient has a proper grooming and clean posture or appearance. So now I'll be going to perform, I'll be going to place the signal devices near the patient and close. Okay. So I'll be going to place the signal devices and and thus the aftercare of the equipment. Um, Putting the signal devices near the patient will enables the patient to call for help, and also um, done doing the aftercare of the equipment will ensure hygiene, and also to maintain good condition of the equipments. So now, I'll be going to perform hand hygiene and assess the patient after the procedure. So, performing hand hygiene or hand washing will prevent contamination, as it is part of the protocol, and also assess if patient has any felt any um, tenderness or any appropriate needs that the clients has. So I'll be going to okay. So now, before that, I'll be going to put a new blanket to the clean new blanket to the patient, so that we'll be able to remove the coverings or any coverings that is attached to the client. So assuming that this is a clean set of blanket, I'll be going to cover the patient. So I'll be going to remove the blanket. Oh, I mean the towel that is attached to the patient, so that we can do the aftercare of all these equipments. So now, I'll be going to perform the hand hygiene and assess the patient after the procedure. Ma'am, do you have any tenderness or any needs?
None of them.
Okay, thank you so much, ma'am. So now, I'll be going to perform documentation using the pen and also the jot down notebooks. I'll be going to document it into the nurse's notes. So this will be the end of performing the complete bed bath of the client. So that's all. Thank you so much.